A dramatic increase in syphilis cases statewide has health officials sending a clear message: get tested. WRAL Investigates is digging into the numbers.
One of the biggest concerns is pregnant women passing the infections to their newborns. WRAL's Joe Fisher shows us this may be another long-term impact of the pandemic.
Wake County is seeing an increase really across the board in sexually transmitted infections. Here at the county's health center, testing and treatment are free, and the people who run this clinic are urging residents to take control of their sexual health.
We want people to get in and get treated as quickly as possible.
Wake County is seeing a rise in STIs, from HIV cases up 42% in 4 years to gonorrhea up 6% and syphilis up 25%.
If you're not treated for syphilis, you can go years without knowing that you have it.
Statewide, HIV cases have remained flat. Chlamydia and gonorrhea cases have dropped, but syphilis numbers have swelled 81% since 2019, with nearly 4,000 cases last year.
There's been a decrease in condom use.
Less protection and less access to testing during the pandemic has led to the dramatic increase. Alonza Pamplin oversees Wake County's STI clinic. She wants parents to have early conversations with their kids.
If you don't teach youth how to use condoms, about condom use, when they do engage in their first sexual experience, then they're not going to technically be able to make an informed decision.
In December, North Carolina health officials issued this public health alert, warning of an increase in congenital syphilis. Over the last 5 years, the number of babies in our state born with the infection increased from 19 to 56, a nearly 200% increase. State law requires providers to test pregnant women for syphilis 3 times during their pregnancy.
There can be irreversible damage along the line if they aren't treated in a timely manner.
Pamplin wants to stop the stigma surrounding screenings to stop the spread.
Definitely get tested with your partner together.
And people should not be waiting until they have symptoms to get tested. It's recommended people get tested at least once a year if they're sexually active, and more often every 3 to 6 months if they have multiple partners. I'm Joe Fisher, WRAL News, Raleigh.
In North Carolina, DHHS says even some doctors are not comfortable to talk to their patients about sexual health. State health officials continue to send messaging to providers, particularly about the increase in syphilis cases.